Good evening, I'm Adrienne Arsenault. Tonight, new advice on masks.
Use of non-medical masks or face coverings is recommended.
Even the Prime Minister's doing it. When you should wear one, and should it be mandatory?
I'm Andrew Chang. Also tonight, the controversial plan that could jumpstart global travel.
The question is it possible?
Low-risk countries choose to open their borders. No quarantine, free movement. Canadian provinces are considering it. BC restaurants reopen.
We have the 4 markers for people to line up.
What you can expect from distanced dining.
Hello! Paramedics making house calls, a virtual triage to help keep patients out of the ER. Can you pull this off in a time when COVID goes away? A Canadian idea that could change healthcare around the world. This is The National. In parts of Canada, people are moving about more than they have been in weeks, and that brings some relief from cabin fever.
But it also brings apprehension that all your efforts to slow the spread of COVID-19 might be squandered. So tonight, a look at some of the latest protective strategies to let Canadians embrace renewed freedoms while trying to guard against a surge in new cases. Things like ramped up testing. We'll show you why Saskatchewan is testing everyone heading back to work. And you'll also see Alberta's push for stronger airport screening to try to keep imported cases out. But we begin with the government's new advice on wearing masks in public. There's now a stronger call for you to do so. David Cochran has the message from the top and how it plays out on the street.
There was a time when people wearing masks outside a store was a sign of trouble. Now, it's a sign of the times.
I don't think it'll stop me from getting it from someone else, but if I have it, I'll stop from spreading it anyways.
Alicia Darcy forgot her mask at home, even though she's a believer.
I actually think we should be already at mandatory level. I think that should have happened a while ago.
Use of non-medical masks or face coverings is recommended.
It's still not mandatory, but this is a shift in the national advice. Early in the pandemic, Theresa Tam said masks could give a false sense of security.
Putting a mask on an asymptomatic person is not beneficial, obviously, if you're not infected.
But as data on asymptomatic spread proved those assumptions wrong, Tam's advice changed. At first, suggesting people wear masks in some public spaces.
Wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you.
To now recommending it as the country inches towards reopening.
More people will be going outside. Public transit may be more crowded as a result. This will help us reopen and add another layer to that. How do you go out safely message, I think.
In situations where I'm either walking through the halls of Parliament or going to my office and coming in proximity to people, I've chosen to start wearing a mask.
And he followed through, wearing it right up until he got to his physically distant seat in Parliament. An example others will follow, even if they don't quite buy it.
Maybe they can hold in some of your, molecules or some of mine, but I personally, I don't think they do any good for you or for me.
Well,
but I'm wearing it. Well, because I
know why he wears
people
it.
feel more comfortable around me, I guess, if I wear one.
Being polite to fight a pandemic. David Cochran, CBC News, Ottawa.
Testing is also key to reopening economies safely, and starting next week, Saskatchewan will have one of the most aggressive strategies in the country. As Bonnie Allen tells us, anyone heading out to work will be able to get one, symptoms or not.
Just being here, back to work, will soon be enough for Trevor Norgan to qualify for a COVID-19 test in Saskatchewan. But he won't be rushing out to get one.
Myself personally, I don't necessarily feel I need to if I'm feeling healthy.
Saskatchewan's testing capacity is relatively high, but demand is low. So starting Monday, the government will expand its criteria to include anyone working outside the home. No symptoms necessary. Hairstylist Shirley Vervok appreciates the testing option, but still feels she would wait for a cough or fever.
I have a family that I go home to, so that would definitely be something I would want to do if I felt like I needed to.
Last week, Alberta introduced testing for asymptomatic people living in Calgary. 3,400 people got tested, more than 100 had the virus.
A negative test today doesn't mean a negative test tomorrow.
Generally, medical health officers have been reluctant to mass test asymptomatic people.
The test itself is not as sensitive as we expected it to be at the beginning.
But infection control specialist Colin Furness applauds Saskatchewan's plan.
We need to be worried about contagion where people don't seem sick. That's actually what's most dangerous. So
he argues provinces should go even further.
We should be testing grocery store workers. We should be testing taxi drivers and transit operators, as well as frontline health folks. They're the canaries in the coal mine.
This plan does not make testing of most workers mandatory.
If it comes down to compelling testing, I think we may have to get to that point.
That would definitely be a conversation that we would have as a team, and if everyone felt like that was the right path, then we would do it together.
But for now, she will rely on other precautions, like wearing a mask, to keep that team safe. Bonnie Allen, CBC News, Regina.
Ontario, which started stage 1 of its reopening yesterday, hasn't even been getting close to its testing targets this week. Yesterday, it processed just over 7,000 tests. The goal, 16,000.
I recognize that the numbers weren't there, kind of shocked me too, but in saying that, we have a strong plan to ramp up the testing.
Any symptomatic person who wants a test can now get one in the province. Health officials say the low numbers this week might be linked to the long weekend or confusion about where to go. So today, Ontario posted another 390 new COVID cases. That's fewer than yesterday, but a bigger jump than just about every other day in the last week. Quebec, on the other hand, recorded a much lower number than usual for the second straight day, 578 new cases. Today, it and Manitoba both announced gathering rules will soon relax a bit.
For now, it will allow us to see friends and enjoy the good weather that is coming. I think it will all do us good.
Starting Friday, people in Quebec will be allowed to gather in groups of 10 from a maximum of 3 households, but only if they're outside. Manitoba is going even further. It will allow gatherings of up to 50 people outside and 25 inside, as long as there is physical distancing.
The local community spread is one thing, but there's also the threat from outside Canada, a threat that will only grow when the U.S. border reopens. Salima Shivji shows us what's being done to mitigate the danger.
For Nick Stewart, the questions he was asked after a flight from Chicago to Toronto were perfectly reasonable, all on mandatory self-isolation.
Do you have a place to stay? Will you have contact with vulnerable people or anyone at all?
In Alberta, more compliance and stricter measures on the way.
It's all for our own good, so I don't have a problem.
Some aren't following the rules to self-isolate. In the first 7 weeks after the Quarantine Act was imposed, police made 2,200 home visits across the country. Only one person was fined. But as provinces reopen, even with international travel down dramatically, Alberta is going above and beyond the federal rules, forcing international travelers to submit a detailed self-isolation plan, like BC has already done, and mandatory temperature checks.
I just don't want to see those sacrifices wasted or those gains lost by not taking every necessary precaution.
Pressure is building on Ottawa as premiers anticipate the opening of the U.S. border, now set for June 22nd. Today, the Prime Minister didn't rule out tracking people's movements with monitoring devices.
We need to make sure that we have the measures in place to be able to ensure that new cases aren't arriving and spreading through the general population. We're in discussion with the provinces and territories.
A tracking band used in countries like Hong Kong doesn't appeal to BC's premier.
We've used the old telephone and knock on the door proposal. What happens after June 22nd, we don't know.
The border question is sure to come up in tomorrow's call between the Prime Minister and the premiers. They want adequate screening no matter how someone enters the country, as Ottawa tries to help all the provinces ramp up testing and tracing to keep the curve flat. Salima Shivji, CBC News, Ottawa.
There's another travel option being considered in some provinces and countries, bubbling locations with low COVID case counts and allowing people to travel more freely between those locations. But as Christine Birak explains, it's not a perfect plan.
There aren't many places where it's happening yet, but the Baltic states are among the first to form a so-called travel bubble.
We had a little celebration here because the border is now open again.
People living in Estonia, Latvia, and Lithuania can now move freely between those countries. All three combined have reported fewer than 150 COVID-19 deaths.
We need to go for a puppy dog.
Screening questions are being asked at the border, but there's no mandatory 2-week quarantine period to protect against travelers who might later develop COVID-19 symptoms.
It's nice to see our customers again.
Australia and New Zealand are discussing a bubble of their own, but scientists say the concept is flawed. Health questions, even temperature checks, don't catch people who aren't showing symptoms. Studies suggest until there are quick COVID-19 tests identifying infected passengers, travel remains risky. This disease tracker says every country inside a bubble would have to have virtually no cases.
It could be something along the lines of 4 weeks with no cases at all. So it's quite a high bar.
In Canada, no new cases have been reported for at least a week in the North, Newfoundland, New Brunswick, and PEI, and there is talk of forming regional travel bubbles.
If you were to include a province that had their numbers under control, then you would treat them like a citizen of your own province.
Some Quebecers are protesting the idea. They want into New Brunswick. Many others see the need to get people and money moving again, but health researchers say quarantines are the safest route.
The virus does not walk around on its own. The virus does not, ride the wind from one part of the world to the other. It comes with us.
Ultimately, it may take a vaccine to burst the bubble so that everyone can move freely. Christine Birak, CBC News, Toronto.
Canadian small business owners barely scraping through May now fear June rent could just break them. The government announced new details of its commercial rent relief program today, but some say it is too little, too late, and too focused on the wrong people. Jacqueline Hansen explains.
At this Toronto pub, plexiglass is going in, but customers are still out.
Our bank account has been completely drained.
The owners have been paying rent by dipping into savings and now federal loans. They're skeptical their landlord will sign on to the new commercial rent relief program, but point the blame at policymakers.
To mandate us to close, but to ask landlords nicely to participate is a joke.
Commercial tenants are eligible for rent relief if their revenue has dropped by 70% or more. But the responsibility is on the landlord to apply.
We certainly expect landlords to be part of this solution.
Ottawa and the provinces will loan landlords 75% of the total monthly rent. 2/3 of that would be forgivable. The landlord must be willing and able to absorb 25%. The tenant would pick up the other 25%.
These businesses are desperate for rent relief. And today's announcement isn't much comfort because for many of them, their landlords have already said they will not be applying for that program.
I haven't heard of a single property owner that's agreed to this program yet.
This commercial real estate broker says landlords likely won't agree to anything until they can see the application and terms in full.
This program is very complex and it could be simplified by having that money go to the people that it's trying to help.
We were hoping for a safety net.
The Canadian Federation of Independent Business says it wants more federal aid to go directly to businesses as well, in the form of forgivable loans.
Then that means that tenants who find themselves in this very difficult position with their landlords have some more help available to them.
A potentially quicker fix than a program that took weeks just to launch and with no fixed date to get money out the door. Jacqueline Hansen, CBC News, Toronto.
Turning now to other news. For the first time since Sunday's snowbirds crash, we are hearing from the family of Captain Jen Casey. In a statement released today and read aloud by a member of the Air Force, they say she died while supporting a mission designed for her.
Operation Inspiration is a mission with one focus: making Canadians happy in a time of uncertainty. And there was no better person in this world to carry out that mission than Jen. Her beautiful smile and positively infectious personality could brighten anyone's day. And she proudly served the mission as she flew across our great nation.
She was from Halifax, killed when her plane went down shortly after takeoff in Kamloops, BC. The family says Nova Scotia will be Casey's final resting place.
There is grief in Edmonton tonight, a mother's grief at the loss of a child right in front of her. A man has been charged, but as Rafi Boudjikanian shows us, tonight is about a little girl named Bella Rose and her mom.
Her soul was true, beautiful, and unique.
This home was a happy place for Melissa DeRosier and her 7-year-old Bella Rose.
She had a huge, kind heart that truly enjoyed life.
Her family now torn apart by a devastating attack 2 days ago. That's when Melissa took in a friend experiencing a mental health crisis, planning to take him to hospital. But as she was putting her daughters to bed, she says he suddenly turned on them, stabbing Bella Rose. Her younger sister Lily survived. Today, police charged 34-year-old David Moss with second-degree murder.
It's heartbreaking. This should not happen. People shouldn't get the help they need.
Sarah Learn is a mother of 4 herself.
This is a parent's worst nightmare. It really is a parent's worst nightmare. And I feel heartbroken.
Happy World Mental Health Day.
Sadly, the DeRosiers already knew all too well the grief mental health crises can bring. Melissa and Bella Rose made this video last year, just months after Bella Rose's father Ben died by suicide.
Learning the signs, becoming informed, and having a meaningful conversation are good places to start. Together we can make a difference.
A theme in Bella Rose's life, she used her summer lemonade stand to raise money for a children's hospital.
She was so full of life, so beautiful, such wonderful. And her mother, Melissa, a wonderful woman, very friendly.
Both kids were very nice. They have been taught how to say bye, hi.
From the mother, a plea to the community.
What I ask you to focus on is celebrating the beautiful little girl that my daughter Bella Rose was and still is.
Rafi Boudjikanian, CBC News, Edmonton.
Okay, time for a quick break. But when we come back, a natural disaster on top of a global pandemic. Next, a super cyclone pummels India and Bangladesh, and the most vulnerable may be too afraid to seek shelter.
COVID-19 screen is positive, over.
And the Canadian idea that could be what's next for healthcare.
Hi, Joan.
Hello.
Here's the paramedic.
A ride along into the future with paramedics keeping patients out of the ER.
And a new game plan for the CFL.
It's a huge blow to lose that game.
We're back in 2. Welcome back. A state of emergency was declared in central Michigan after 2 dams failed following heavy rains across the state.
Experts are describing this as a 500-year event. It's going to have a major impact on this community and on our state.
Rapidly rising water overtook the dams about 2 hours northwest of Detroit. 10,000 people were forced from their homes, with some areas near the river expected to be under 3 meters of water by day's end. Now, overseas, a vast area of eastern India and western Bangladesh has been devastated by cyclone Amphan. It's one of the most powerful storms to hit the region in decades, with sustained winds of up to 170 kilometers an hour. Chris Brown shows us.
While the big picture of the cyclone's destruction is still unfolding, up close it packed a furious blow. Transformers in the city exploded in a display of fireworks as trees fell onto power lines. And on the coast, a storm surge may have swept thousands of homes out to sea. Some areas 10 to 15 kilometers from the coast could be inundated, said the Indian weather official. Of huge concern is the fate of those in and around Cox's Bazar, Bangladesh. The rickety tents of 1.3 million Rohingya refugees who fled from Myanmar could have been obliterated. And though the rains were pounding, the camps appear to have been spared a direct hit. Even so, After the storm passes, the dangers will persist.
Now we have a disaster within a disaster.
We reached aid worker Rachel Wolf of World Vision, who's in Cox's Bazar working to improve sanitation in the fight against COVID-19, which Bangladesh has managed to keep relatively contained so far, with just 400 or so recorded deaths.
Once people leave those shelters, we want them to stay in their village, limit movement as much as possible so that then we can monitor and make sure people get tested and follow up. But it's going to be tough because, no doubt there will be homes that are damaged or destroyed.
It also appears millions overcame their fear of the coronavirus and sought safety together in storm-proof shelters. In some areas, authorities more than doubled the number of buildings available to try to avoid excessively crowded conditions. Tonight, the Indian state of West Bengal is getting hit hardest by Cyclone Amphan, but with communications down, a full assessment may not be known for days. Chris Brown, CBC News, Vancouver.
While some countries, like Canada, are beginning to emerge from lockdown, others are still very much in the grip of the coronavirus pandemic. In fact, more than 100,000 new cases were reported in the past 24 hours. That is the most in one day since the pandemic began. There are now nearly 5 million cases around the world. The U.S. has the most, followed by Russia. But now Brazil has surged past the U.K. into third position of this terrible race, recording more than 290,000 cases. Despite that concerning surge, Brazil's president has an altered course. Jair Bolsonaro has long minimized the virus, and as Stephen D'Souza tells us, now he is doubling down on an unproven treatment.
In Sao Paulo, Brazil's largest city, an already sprawling cemetery is expanding, and the mayor warns the health system is on the verge of collapsing. On the doorstep of the Amazon, the mayor there warns the virus could decimate local indigenous populations. Brazilian President Jair Bolsonaro has consistently played down the risk of the virus. He recently argued that while it's regrettable people are dying, more will die if lockdowns destroy the economy. His approach has cost him 2 health ministers, both medical doctors. One was fired last month. The second resigned last week, refusing to push Bolsonaro's plan to expand the use of the controversial drug hydroxychloroquine.
There's a lot of incompetence, there's a lot of lack of leadership.
Today, Brazil's interim health minister recommended doctors prescribe chloroquine, even for mild cases. Brazilians are being asked to sign a waiver saying they're aware of the side effects, including death. Many experts suspect Bolsonaro is pushing the same drug as his ally Donald Trump says he's taking, because Bolsonaro wants it to be his solution to the pandemic.
Bolsonaro is a very, very smart politician, and he's all the time trying to understand what can fit a narrative where he appears to be a great leader.
Bolsonaro has a solid base of support, mainly amongst the country's poor, who need to work to survive.
Now we have 3 crises. We have the sanitary crisis, we have the political crisis, and we have an economic crisis.
Local politicians are stepping up to fill the leadership void. In Sao Paulo, today was the first of a 6-day holiday to promote physical distancing. The fear is what comes next, with the virus showing no signs of slowing down. Stephen D'Souza, CBC News, Toronto.
Well, ahead on The National, dining at a distance. We'll take you inside reopened restaurants in British Columbia for a look at what guests can expect.
Would you like to see this represent a new type of healthcare in Canada?
Yeah, absolutely. Yeah.
First, though, a Canadian healthcare experiment. COVID made them try it, but it might live well beyond the virus. A ride along with paramedics who are clearly onto something. Welcome back. In taking so much so quickly, COVID-19 has forced a reckoning with aspects of healthcare in this country. A long look at long-term care homes will come soon, but other possibly revolutionary projects are here already, like a virtual triage system using paramedics in Ontario's Renfrew County. They invited us for a ride along.
Feels ready and diaphoretic, short of breath. COVID-19 screen is positive. Over.
There are still the emergencies now.
559, copy.
The inevitable wrenching calls that end the way you might expect, with a panicked, terrifying trip to the hospital. But this is not about that.
Hi, it's Stephanie calling from the Community Paramedic Program. How are you? You're waiting for me? Perfect. Because I'm coming out.
This is about a COVID-era experiment with paramedics.
Hello? Hello? I've got some friends with me today. Is that okay? We're all in masks. Oh, look at you with the heat pad on your arm. How are you feeling?
And this possibly is a peek into the future.
We're doing methotrexate today? Yeah. Okay, and your blood work.
Paramedic house calls for those who can't see family doctors now and don't need or want an ER.
You're not feeling like dizzy or no new cough, shortness of breath?
Bored.
Everything in its...
Is that a sickness, bored?
You know what? It's hard right now, right? It's like so difficult. Everybody's kind of facing the same stuff.
Renfrew County paramedic Stephanie Rose filmed by her colleague taking a little blood, administering a shot for Annette.
When I saw that and I thought, well, you know, how nice is that? You don't have to go and sit in the emerge for 4 hours.
Right. For something that can be fixed pretty quickly.
Can be fixed at home, and you're so more comfortable at home instead of laying on a stretcher for hours.
We will get out of your hair.
Okay.
Community paramedics countrywide have long done outreach work a bit like this. But when COVID started its march around the globe, Renfrew County's chief paramedic Mike Nolan started thinking bigger. What if there was a better way to deliver health care? He thinks he's found it, thinks he's now doing it.
Everybody has access to a family physician 24 hours a day, 7 days a week. And for those people that we can't help over the phone or over a video conference, the paramedics are in their homes that same day, making sure they have exactly what they need to stay safe and healthy. And the remainder, unfortunately, weren't able to get a hold of their family doctor, or they weren't available because it was out.
Imagining new ways to care for people at home was brewing for a while for Nolan, but kicked into action the week the pandemic was declared. He worked with tech teams, paramedics, and doctors, including Jonathan Fitzsimon, to develop VTAC, a virtual triage assessment center.
So patients call and they speak to a receptionist, and the receptionist takes their details, and we see the schedule, and as soon as a patient is booked in, I call them. 12 days from our first conversation to getting approving from the Ministry of Health to going live. That's unheard of in healthcare.
Because everything is possible with money and political will. Both of those may come to an end.
Yeah, you're absolutely right. There is the risk that the funding for this ends. That tap can be turned off as quickly as it was turned on.
And so a push to understand if this works. 2,500 patients cared for this way since mid-March. The bulk of the calls from people who don't have family doctors.
I'm here at the VTAC desk, just looking to check in.
With physician shortages here, a bigger role for paramedics could offer an answer.
How you doing, man? Here, these are for you.
It certainly did for Kim and Denise Groves. Both tested positive for COVID-19, both able to recover at home, thanks in part to paramedic Matt Roussel.
Yeah, I just actually wanted to see how you were doing.
I'm doing very well, thank you.
You look a lot better.
Oh, I feel a lot better.
Yeah.
I think you saved my life.
Well, no, I was not worried. I was concerned, we'll put it that way, when I first saw you. But
well, I was concerned too, because I sure didn't feel very well.
Dropping off medication for Denise, who's still testing positive, and just checking in with Kim, now COVID-free and enormously relieved.
He did you a solid.
Oh, he did me a real solid. I think I would have kicked the bucket if he hadn't have done it, truthfully. Oh, I couldn't even get off the couch. They had to help me into the bed. I was right done. And I'm sure glad that I got an IV put in me in bed, that doesn't happen with paramedics too often when they come and give you an IV and take your blood, so it was great. I didn't have to go anywhere.
We'll be in touch, okay?
All
It's
right,
good to see you,
Matt.
Okay, take care.
Would you like to see this represent a new type of healthcare in Canada?
Yeah, absolutely. Yeah. I think it's progressing to this point now, and COVID just didn't give us another chance to do something else. We didn't have a choice. We had to do this.
Other counties, other countries are now curious about duplicating the program.
To share their great ideas, to share the
Take
evidence.
a spin through Michael Nolan's paramedic WhatsApp group and you'll see a global ideas exchange happening at a breakneck pace. Nations further along in the COVID experience sending tips to those just starting, including advice from Spain in wrapping the inside of ambulances in plastic to make them safer and easier to disinfect. It's already put into action in Renfrew County.
It is, I think, the call to action of our generation. There is no going back. There is no sense of normal, because I don't know anybody in the healthcare system that was entirely happy with it.
But can you pull this off in a time when COVID goes away and everyone goes back to work and the roads are busy again and the schools are full?
We can absolutely continue to provide this level of service for both COVID and non-COVID patients going forward. Right? COVID will be replaced by the flu or the second wave or the third wave.
That confidence will get tested, and it's not clear how this would work in a city, but COVID has cut through the red tape, so now they leap in where needed. A last stop of the day at a seniors' residence that is so far COVID-free. The "we miss you" signs everywhere are a reminder that being safe isn't always being whole. A few more residents here need COVID swabs.
Go. Check. Yeah. Doubles on.
The paramedics are meticulous with their PPE and again wearing cameras.
Cool. Ready? Yep.
Journalists certainly not able to head inside. In a place with no visitors, the paramedics are kind company.
Hi, Joan.
Hello.
Here's the paramedics to do.
This is Joan Walsh. She's mercifully in really good health, very much missed by her big family, and willing to come to the window for a chat. How are you doing?
Oh, I'm doing fine. I'm an awful book reader, so I'm reading books. I've got 8 children.
Five sons in the valley and 3 daughters.
Boy, they must all want to hug you. Is there anything you want to say to your children or your family?
I tell them all the time I love them, and they tell me that too. I don't know what else to say.
That's all there is at the end of the day. It's all that matters, right?
Yeah.
There we go.
Keep yourself safe, okay, Joan? I will. All right, my dear.
The little things are the big things now. Care that takes its time, paramedics who go out of their way, and people imagining that when we're all out of this, maybe we will have built something better.
So what an interesting and potentially critical innovation. Adrian, you said something in the story about cooperation with other agencies. What other sort of things did the Renfrew County team learn?
Well, conversations with paramedics in Hong Kong, for example, in early January were really helpful. They advised Mike Nolan's team to start stocking up immediately with PPE. They talked of the risks of picking people up with COVID and transporting them around in these confined ambulances. They all wondered about a better way. So the ideas started percolating, right away. And a curiosity of COVID is that bureaucracies that sometimes get in the way of implementing good ideas, the bureaucracy has evaporated a bit and experimentation is happening. So we'll see where this goes. All right, still to come tonight. 40 years after Terry Fox's Marathon of Hope, a special commemoration sells out in mere moments. We'll hear from Fox's family in tonight's Moment.
And in just a few moments, we'll have Dr. Nimji back in to try to take on your COVID-19 questions, including this one about masks. Given today's recommendation by Dr. Tam, what kind of non-medical masks should people wear? Paper, cloth, the ones with the little valve on it? After this. Welcome back. With much of the country slowly reopening and new directions from public health on where and when to wear a mask, your questions keep coming in. So joining me now to answer a few of those, ER physician Dr. Tasleem Nimji. Hello, Dr. Nimji, once again. Let's get right to the first question. Given today's recommendation by Dr. Tam, what kind of non-medical masks should people wear?
So I think what you're seeing is a lot of people wearing cloth masks, which is reasonable. And there's been conversations around the type of fabric to use, and you're looking for like a tightly woven cotton mask, for example. People are also using paper masks. And I think the key here is, again, these are non-medical grade masks either way. So we don't want people to be pulling away from the medical grade masks that are being used and required in hospital settings or healthcare settings. But these would be masks that you can either make at home or purchase.
Because are those blue paper kind of surgical masks, are those medical masks?
So the masks that we use in hospitals look very much like that. The ones that you might be buying, if they're not coming from a medical supplier, I can't speak to whether or not the filtration or the quality of the paper on the mask is the same. I don't know. I imagine that it might not be. So they look the same, but might not be exactly the same.
What about those masks with the valves or the respirators on the front? Are those recommended?
So I don't think, again, when we look at why these masks were recommended today, it was really around people that may be either just before they get symptoms, so we call that pre-symptomatic, or not have symptoms, called asymptomatic people, from stopping the spread to others. So it's about really limiting the respiratory droplets exiting your mouth to go past that distance if you can't maintain that 2-meter distance. Whereas when we use these masks in healthcare settings, it's really about keeping the healthcare workers safe as they are exposed to infectious particles coming from the patients that they're treating, right? So in the setting that's being described or recommended today, where we have individuals wearing the cloth masks to limit, and again, it's to decrease the amount of viral spread, then the cloth masks are sufficient, and you don't require the valves or the fancy sort of respirators on the side.
Okay, we've got time for one more quick question. If you wear a disposable mask, can you put it aside for a few days and consider it virus-free?
So you can put it aside for a few days. You just want to do that in a very careful way so that it's not going to contaminate surfaces or be something that other people might pick up inadvertently and then become contaminated themselves. Right. You want to be able to store it safely, but if you have stored it for a couple of days, coronavirus isn't very stable past that time period, so we can assume that the viral particles would be dead by then and it would be fine to reuse the mask. But if you're using a cloth mask, we do advise that you actually wash that mask.
Dr. Nimji, always good to have you on. Thanks so much.
My pleasure.
And as we've mentioned, we'll be asking your questions about COVID-19 every night going forward. So send us the ones you have on Instagram at CBC The National or by email at covid@cbc.ca.
Next, restaurants are reopening, but is there an appetite to dine out?
We missed the dim sum, yeah, for sure.
An inside look at dining at a distance and why some restaurants are staying closed.
I'm Pia Chattopadhyay. Tomorrow on CBC's daily news podcast, Front Burner, what the pandemic is revealing about the meat processing industry and how it's affecting the whole chain, from Alberta cattle ranchers to food inspectors. Subscribe wherever you get your podcasts.
Welcome back. 4 days before its preseason was supposed to kick off, the CFL now has a later speculative starting point and a radically different ending. That's if any games are played at all. Today, the league launched a Hail Mary to save what it can, but as Devin Haru explains, the cost is high.
Certainty is really hard to come by.
But today, the CFL commissioner tried to provide what he could. The league, desperate to salvage even a shortened season, saying it could start as late as September.
We are looking at multiple scenarios. We haven't, we're not really ruling anything out.
Including, unfortunately, canceling the entire season. But if there is a Grey Cup this year, it won't be in Regina as scheduled.
For the people of this province and the province and the city as a whole, it's a huge blow to lose that game.
I feel for the Regina businesses, the Saskatchewan businesses that have probably already invested a lot of time and energy.
It's a big blow to the city's bottom line.
We projected about a $16 million impact on our economy.
Losing the traditional Grey Cup week, a huge concession. Instead, any championship game will be hosted by the qualifying team with the best regular season record.
A win and host model was better for this year, given these very unique circumstances.
It's the latest setback for a league that recently asked the federal government for tens of millions in aid.
There is an opportunity to take a step back, revisit our business model.
The CFL has assured Rough Rider fans they'll host in 2022. The only certainty the league could give football fans, waiting for answers. Devin Haru, CBC News, Toronto.
So Canadian pro sports are still off the table, but BC restaurants are back in the game. After flattening their curve, the province is now allowing limited access, but as Renee Filipponi discovered, it won't be quite the same experience diners remember.
It's the first customer Victor Liu has greeted in more than 2 months. He's excited, but says it's taken work to get here.
So we have the 4 markers for people to line up.
The dining experience now is different. Staff here will wear masks. Menus are wiped down with sanitizer between each use. And physical distancing is key. Half the tables are gone, and barriers have been built to keep customers apart.
We need to put more dividers.
Liu says it's going to be a struggle.
We'll predict, and for the coming 3 months, we will not making any profit at all.
Hundreds of inspectors will be checking in, making sure the rules are followed.
We have the ability to close places down, shut down work. We have the ability to shut down portions of the work. We have the ability to institute fines.
But sticking to the new guidelines is near impossible for some. That's why Brian Grant's distillery is staying closed for now.
All of the compliance things that we need to do now for COVID, plexiglass, 2 meters, the space, 50% capacity, all these things add up to making it very, very difficult.
Grant has been able to keep afloat by making hand sanitizer. But he says for many restaurants already working with small margins, this could be the end.
The damage is done in a lot of ways, and I don't know how we can really recover from it. I think some places can recover, some of the big chains and so on and so forth, but where does that leave the smaller restaurants?
These early birds are ready to dive in and support their favorite restaurant.
Everyone should come out. Yeah, as long as we have a good distance.
And we miss the dim sum, yeah, for sure.
It's unclear how many customers will be as willing, and whether these businesses can survive will depend on their appetite to dine out.
All the best.
All the best.
Renee Filipponi, CBC News, Vancouver.
And while British Columbians enjoy the extra legroom at their favorite locales, burger lovers in the British Isles are flooring it to their local Mickey D's to wait in line in their cars. McDonald's UK reopened about 30 drive-through locations across the country for the first time since March 23rd. Given safety protocols, the service apparently isn't lightning quick, and even if it's been a while, customers can't exactly make up for lost time. Orders are capped at £25 sterling or about $40 per vehicle.
The Moment is next on The National. Tonight, it's commemorating a moment in Canadian history. 40 years after Terry Fox's Marathon of Hope, a sold-out success. Next.
It's been 40 years since Terry Fox began his run across Canada. And today, limited edition replica sneakers went on sale, just like the ones Terry wore during the Marathon of Hope. And all of this to raise money for charity. The anniversary sneakers sold out in less than 5 minutes. Surprising even for the Fox family. And that is our moment.
We were completely blown away by the response earlier to the release of this shoe.
We knew it would be, people would be ready and it would be busy, but I don't think anybody anticipated them selling this quickly. And I tried to get a pair of shoes myself, but I wasn't able to. All the money raised from the sale of these shoes and the t-shirts are all going to go directly to cancer research. In 1980, when Terry was getting ready for the Marathon of Hope, he obviously needed a pair of shoes to get him across the country. So he sent a letter to Adidas, and they were on top of it right away. Terry's legacy is alive and well, and it's still important today to be raising money for cancer research.
So I'm still struck that it's been 40 years. I mean, as a kid, I remember very clearly hearing the sound of him running, the sound of him breathing. The image of him was something I sort of rushed to see on the TV every night. And yeah, those shoes. It's not just that he wrote to Adidas and they responded to him. He wrote to a whole bunch of companies, and it was that one that said, absolutely here, 24 pairs of these shoes. And there you go.
Right, and you know, I'm not one to use the word iconic too lightly, but those shoes are it, right? I mean, you cannot divorce the sight of those shoes from the image of Terry Fox doing what he did. And, you know, such a powerful symbol, and that it's all come full circle like this after 40 years. That's That's something. That's the National for this May 20th. Good night.